This podcast is brought to you by the good people at Living with Hemophilia, the online hemophilia community brought to you by Bayer. Living with Hemophilia is the destination of choice for a plethora of useful info, like medical and non-medical tips, helpful advice, information on programs for all ages and stages, leadership opportunities and initiatives, sewing patterns, and videos, the best videos. And because it's on the internet, it's easy to find. Simply type in livingwithhemophilia.com into your search bar, and there you are. Thank you, Internet. Join Bayer's community of fellow hemophilia patients, caregivers, and advocates as they put the live in Living with Hemophilia. You can even like them on Facebook. That's even better because then you can use emojis on their Facebook page and receive all the latest updates. So check out Living with Hemophilia. And before you wish happy birthday to some friend from the 3rd grade or share a funny meme about cats and Mondays, head over to Facebook and like Bayer's Living with Hemophilia page. You'll be glad you did.
Imagine having all the symptoms and even the diagnosis of hemophilia, but you are constantly hearing that it is impossible for you to have the condition. You undergo surgery without having factor available, consistently suffer from bleeds, and are placed in life-threatening situations despite the fact that your factor levels have consistently shown that you have mild hemophilia. While this sounds like an outrageous scenario, many women with hemophilia have lived this exact same story. For episode 20 of the Ask the Expert podcast, we will dive into the challenges faced by women living with bleeding disorders and their struggle to receive a proper diagnosis. I'm your host, Chris Bombardier, and this is our Women with Bleeding Disorders episode of the podcast. I'm really excited to welcome our guest, Tammy Davenport, to the podcast today. Tammy has been an advocate for a more inclusive and accepting community for women with bleeding disorders, as well as for equal access to care and diagnosis. She is the founder of the Women's Bleeding Disorder Coalition and also uses her experience and knowledge of meditation and yoga to help those manage their bleeding disorders. Thank you so much for joining us today, Tammy.
Thank you, Chris, for having me. I'm excited to be here.
Maybe we can start off with just a little bit more information about who you are and how you decided to be an advocate for women with bleeding disorders.
I didn't really set out in life, even, as a young adult with the intent of doing what I do today, but my story is that my father had hemophilia A, and he passed away in 1981 from hepatitis C and cirrhosis caused by tainted blood products. He was quite forward-thinking for his time. He had my sister and I tested when I was 5 years old. My sister was 2 at the time, and my levels came back at 23%. We received a letter from the University of Texas Health Science Center, just telling what my lab results were and that I had hemophilia A, and if I ever needed to have surgery or was in a major accident, I would need factor. And that's really the only information that we had to go on. So my father passed away a couple of years later. I was raised outside of the community. I never saw a hematologist other than being tested until I got pregnant with my son. And I was raised with the awareness that I had this diagnosis, but had no concept of what it meant for my life or how it would impact my life. I just thought, the couple of things that I'm having issues with was really minor compared to what I knew my father had went through. So I really didn't give it a lot of thought growing up, but I was aware, of what my diagnosis was. So when I was 20 years old, I got pregnant with my son. I knew what the possibilities were that he would have hemophilia. So I was, as much as you can prepare for that, I knew that was a possibility. And then whenever I checked in to labor and delivery to have him, I had him at a major teaching hospital here in Texas. And I told the physicians that you need to be aware that I have hemophilia. And their response was, that's impossible. Women can't have it. So here I am. I'm very young, very naive. And, I just assumed that if something happened that they would take care of it because, I did tell them that I had a bleeding disorder. So I thought that, if anything happens, they know what to do, even if they don't want to admit it to my face that, it's even possible. I did have some issues with my delivery, mainly from the epidural was my biggest one. It caused a hematoma on my spine, the size of a golf ball, and that took a year to resolve. And I had no factor at that time. I had no access to medication at all. So over the next couple of years, when I'm really learning how to recognize bleeding symptoms in my son, I start recognizing that these are symptoms I've had my whole life and had no clue that they had anything to do with hemophilia. Things like joint pain and, trouble walking, trouble standing up, and at this time, my son was being seen by a hematologist at one of the largest HTCs in the country. And so he started following me as well and was giving me guidance on treatment, and his staff was really great. That was really my first experience with Factor. So here we are, mid-90s. I finally, I'm about 23 years old at the time. I finally have access to Factor, and it completely changed my life. Because of that experience with that hematologist, I got a little spoiled because, I thought, okay, well, this was really easy, even though I didn't have access to this growing up. Now I do, and it's great. Well, that hematologist left, and another hematologist came in whenever I was preparing to have a hysterectomy. That was right at the transition in the changes of the director of the HTC. This doctor did not believe that I had hemophilia. I had a hysterectomy without Factor. I had a lot of complications from that. And exactly 2 months later, I had to have emergency gallbladder surgery. So my primary care doctor was the one who diagnosed that. And so I told him, I'm not going into the medical center for this. And I explained to him what happened. And he told me, if you can get our hematologist to sign off on this, we'll do the surgery here, which is an outlying area of Houston. So I said, okay. So I walked from his office to a private hematology office and just sat down, told the hematologist, this is what's going on. And I didn't have any paperwork with me. I had nothing proving what I was saying. So I was really surprised that this older gentleman, he was about 70 years old, was just so open-minded. And he's like, absolutely, and so we talked a little bit about my experience, and he said, can you bring your Factor in? I said, absolutely. So I saw him 3 times before my surgery, 2 days later in the hospital, and then he followed up with me afterwards. And so, that was a really good experience for me. I had no complications from that surgery. Since then, I have struggled to find a physician who is willing to prescribe Factor, and I really approach my struggle to find a doctor with the approach that, I'm interviewing them for a job. I'm interviewing for them for their expertise as part of my healthcare team. So, I'll go in, I'll ask the questions, do you treat bleeding disorders? I have hemophilia A, and if their response is, women can't have it, or you should never have any issues, you're fired.
Absolutely.
I no longer spend weeks and months fighting with a physician to get them to see my point of view, because chances are it's not going to happen. So it's just not worth this for me.
Just even being diagnosed at 5, which was very rare at the time, and having that diagnosis that doctors still wouldn't believe you and still wouldn't believe that, a woman can have hemophilia, even with all the complications from surgery, that it was still a battle. That just is fascinating to me, because, if a young man or that is mild hemophilia, 23% like yourself, had any of those complications, they would have hemophilia, and that would be it. That would be the end of the story. I love that you have this interview process for a physician. Did that kind of process inspire you to get into the advocacy realm? Is that how that happened?
As I'm going through this process of finding the right healthcare team for me, I start getting messages from other women who are struggling with the same thing. And it just kind of snowballed, and pretty soon I find out I'm the person that these women are coming to for advice. And I'm helping them, usually a one-on-one basis through whatever issue they're going with, whether they have Factor. And, a lot of women will have Factor, but transitioning from being the mother and the caregiver to being a patient is a little complicated in itself. It's a whole change of mindset. And even though I had my diagnosis and I was raised with it, I went through the same transition because I didn't have access to medication either until I was an adult. So in a lot of ways, I do understand what these ladies are going through when they're not being diagnosed until their 20s, 30s, 40s, and sometimes even 70s, and having access to medication, and learning, when to treat. And sometimes you don't even know. We have to just kind of go by how we feel. And I kind of take it upon the values that I learned, when I was learning how to treat my son, is when in doubt, infuse.
Do you notice any long-term joint issues or target joints since you haven't had treatment or the access to the treatment until your 20s?
Absolutely. So I will be 45 next month, and I have extensive joint damage in my knees. I have chronic pain in both feet from previous injuries. I really don't have anything to compare to as to, what's normal and what's not. But I know, from the standpoint of my knee joints, that is due to bleeding. I've had a lot of issues with those, and, they were my target joints. I ended up on Prophy, and I've been on Prophy for quite a number of years now. And that's really kind of changed my quality of life. The overall improvement in how we feel after factor is, a lot of people might say it's a placebo effect. I don't think that it is. My theory is that, who knows what the normal wear and tear of our body does internally from day to day. I mean, we may be having these little microbleeds throughout our body that maybe is like just oozy or something where a person who had normal factor levels, may have a little ache and ours just kind of hangs on. There's a very good possibility that, all these little muscle tears or, achy joints or whatever that we have going on from day to day are little, maybe numerous microbleeds throughout our body. And that's why factor makes us feel better in general.
As you'd mentioned, you started recognizing symptoms in yourself. You went through all these surgeries with some complications. And then as you started finding those hematologists that would actually give you factor, other women started reaching out to you and asking for advice. How did you first handle those questions? And then how did it lead to the Women's Bleeding Disorder Coalition? And what inspired you to start that?
Well, when I first started receiving phone calls and messages, I really gave advice based on my experiences, not only in learning how to communicate with medical personnel through my son's diagnosis, but the fight that I had for my own care. So I really do teach women, like, it's okay to fire your doctor. If you're not being heard, if they're not being willing, I'm not just going to say, to prescribe factor, but if they're not willing to be a part of your team, and there's no I in team. So, if they're not willing to communicate properly, it's okay to fire them and find someone else. So that's really kind of where it all started. And then the more and more that I heard from women and the lack of national conversation that was going on at the time, this was 5 years ago, and there really wasn't much going on for women. Nobody wanted to talk about it. It was still a little taboo, I think. And in a lot of ways, I became public enemy number one. Like, nobody wanted to rock the boat, I guess. And so here I am having this conversation on a national level that really doctors did not want to be having. Some of the leaders in our community didn't really want to be having. Maybe they didn't fully comprehend what was going on behind the scenes. And so, all these women are struggling day to day with obtaining a diagnosis, or, maybe they're not connecting the dots in their own healthcare and not realizing that some of the symptoms they're having has anything to do with their carrier status. And I really think educating from the level of fathers of carriers to women who are carriers on up to our national organizations and even the CDC is very important in making sure that there's a standard of care across the U.S. for women. Advocating for women became my passion, and I did not want the next generation of girls to have to go through what we've gone through. So that was really setting the standard for our future generations was really what motivated me.
You mentioned that there was some sort of stigma around giving women a diagnosis of hemophilia. Where do you think that stemmed from? And I heard that term symptomatic carrier for years and years. What does that term mean to you? And how do you think we should be talking about bleeding disorders?
I think that the stigma around giving women a diagnosis has been such a struggle for us because it was historically known as a man's disease, and I'm using air quotes here, a man's disease. So, women were just carriers and we really didn't suffer from it. And changing those myths and those long-held beliefs is very, very difficult. We have even our HTCs today that are not willing to prescribe factor for women. And I hear the most horrendous stories of what I would consider malpractice coming from our HTCs, to their female patients. And, when they come back to me, I'm like, it's 2018. We should not be dealing with this today. But, gender bias in healthcare is prevalent among all aspects of healthcare, even though specifically today we're talking about bleeding disorders. And then, you have the term symptomatic carrier, which in some cases I think just gives justification for a physician not to treat because it kind of diminishes the diagnosis. And I've dealt with that all of my life as well. But I know on the clinical side that from 40 to 60% of factor levels is really what they consider a symptomatic carrier. But that tends to get complicated as well because women's levels fluctuate from day to day. So I may be 20% today. Tomorrow I'm 70%. Does that mean I no longer have hemophilia? It doesn't. And it really doesn't have any corresponding evidence to what my bleeding symptoms are. So, in order for women to be treated effectively, I think maybe we should get rid of the symptomatic carrier status and treat based on symptoms versus just strictly on levels.
I think that that even occurs kind of just with, severe, moderate, mild in that discussion. Severe can be the worst, but, it's very person dependent, right? There's some severes that don't bleed as much. There's some milds that do bleed more. So it should be based on individual symptoms and how much you're bleeding as a person, not necessarily as some number, right?
Right. And, we're finding that many mild women bleed more than severe men, or as much as severe men. I bleed more than my son does, which is really strange. And I hear that a lot from women, that they have more bleeds than their children do. So, it really is very much individual.
What is the general guidance that is provided by national organization or is now being provided by national organizations? Is it changing? Is it evolving? Just in general around, diagnosing women with bleeding disorders?
I think we're really seeing a bit of a turn in the conversation about women. There's much more programming for women that you see now, even at the local level, but all the way up to the national level. One of the things that I kind of follow is MASAC guidelines. And according to MASAC from the NHF, they say up to 50% of carriers actually have hemophilia, which would, in their recommendations cite that having a factor level under 50% classifies you as having hemophilia. So, if we think about just the sheer numbers of carriers that we have just in the U.S. alone, and up to 50% of those ladies and girls could be having hemophilia and having symptoms, and most of them are not being diagnosed or treated.
It seems like there's a huge underserved population right there that we need to definitely address. Is there any programming going on to help increase the knowledge and awareness out there about, daughters of people with hemophilia tested and getting their levels checked? And then also, you mentioned that levels fluctuate so much from the day to day. Is there any guidance around how many times somebody should be tested to confirm if they have hemophilia or confirm they don't have hemophilia?
Unfortunately, there seems to be no uniform standard of care for diagnosing or treating women or girls in the U.S. Each HTC treats differently. Some don't treat at all. And I've had fathers contact me and said my HTC will not even check factor levels for my daughter. And these are huge issues. Some of the HTCs that I'm hearing about want to wait until the child is a teenager and, getting ready to start a family. And that's just a very dangerous position to take because, especially for me, having had my diagnosis early, I knew that if I was in an accident, I was going to need factor. And what happens if, a father with hemophilia is in a car wreck with his 3-year-old daughter and they have no clue where her levels are? So for me, it's a liability issue. We should be testing early and we should be testing regularly throughout the life cycle, because they do fluctuate. And what she is at 3 may not be what she is at 12 or 13. And, making sure that the families know what symptoms they need to be looking for, and hopefully she never has any. But in the event that she does, you need to recognize what you're seeing.
This podcast is brought to you by the good people at Living with Hemophilia, the online community brought to you by Bayer. Living with Hemophilia is the destination of choice for a plethora of useful info like medical and non-medical tips, helpful advice, information on programs for all ages and stages, leadership opportunities and initiatives, sewing patterns, and videos, the best videos. And because it's on the internet, it's easy to find. Simply type livingwithhemophilia.com into your search bar and there you are. Thank you, Internet. Join Bayer's community of fellow hemophilia patients, caregivers, and advocates as they put the live in living with hemophilia. You can even like them on Facebook, and that's even better because then you can use emojis on their Facebook page and receive all the latest updates. So, check out Living with Hemophilia. And before you wish happy birthday to that friend from 3rd grade or share a funny meme about cats and Mondays, head over to Facebook and like Bayer's Living with Hemophilia page. You'll be glad you did.
Now that we've been kind of talking about some of the challenges you faced and some of the challenges that are currently being faced by women, what do you think are the biggest challenges that are being faced and what are the biggest challenges in the future for women with bleeding disorders?
Right now, I think one of the greatest challenges that we have is getting all HTCs to recognize and treat women appropriately. Many times we have to send women to other states to go to an HTC. And unfortunately, many of our women are having to go outside of the HTC system just to receive care. So, women in my position, I don't go to an HTC, but women in my position, I have to choose, do I want access to Factor or do I want the resources that are available to HTC, because I can't have both. When I have a serious injury, like I recently broke my foot, I could have really used a physical therapist who had experience with hemophilia, but I didn't have access to that. So the only thing I could do was treat the bleeding, which took forever to resolve, and then, do my own physical therapy, So what I ended up doing was, as soon as I felt it was safe to do so, I started yoga therapy on it. And, I would have loved to have a comprehensive team that I could call and say, I'm having this issue and I just broke my foot and what do I do next? And, I really didn't have any resources to call on that had specialized experience with bleeding disorders. And we see that a lot in our female population. So I think that's going to be one of the challenges that we're going to have ongoing, is that even if women go outside of the HTC system and go to a private hematologist, they still don't have access to the comprehensive care that we need to be having access to.
I mean, I also am just thinking back to, as many bleeds as I've had, having that team to be able to call and go in and see the physical therapist and then see the nurse and the doctor and that whole entire team. It's such a huge benefit, to having hemophilia, and let women not having access to that just doesn't seem right. That seems like a huge challenge. And I know you've created this amazing organization that is doing a lot to advocate for those needs. So what are some of the ways that the Women's Bleeding Disorder Coalition is tackling these unique challenges that women face with bleeding disorders?
I think one of the things that we've really been able to put together is, because, Stormy Johnson and myself, we run the entire organization. So we're able to approach our programming from the experience of having gone through that. So when women come to our events or to our retreats, we know where you've been. We know what you're going through. We can be there to offer support. Sometimes we can offer advice. And so we really try to, as much as we can, work one-on-one with women. Even if it's, we've provided some travel scholarships so that women could go to HTCs in other states. And, sometimes they needed help with a co-payment or something just so they could get into an HTC. So those are little things that we've done that we really have been focused on, and Stormy and I both say, everyone wants to get together and have a good time. But if we are not changing the lives of the women in our community, we're failing in our mission. So even if it's, taking one woman at a time, helping to get her care, helping to get her diagnosis, whatever it is that she needs at that time, that's what our mission was. And so that's what we do. So, while it is good for us to get together and have that social support and have a good time and get to know each other, our real mission lies in changing the lives of women. So, if we're not meeting that mission, we're failing. So that's really kind of one of the things that, we've really approached it. And we recognize that there are some organizations that do a really great job on the clinical education, so we don't focus heavily on that. Our approach is a very holistic approach, a lot of talk about self-care and setting boundaries, healthy boundaries. We do a lot of program around chronic pain and depression, all the things that we as women deal with and that we hear from other women. This is what we really need to, be learning about and what we really would like some programming for. So, we are able to take those suggestions from women and incorporate it very easily into our programming.
You do a lot to tackle depression and chronic pain in really unique ways, and that you're actually having a retreat coming up at the end of this month. So could you just elaborate on that and also kind of talk about why you take this approach to self-care? Because I think it's really cool and unique, and I think everybody should hear about it.
Oh, well, thank you. So yes, we are having a retreat in Florida at the end of October. One of the main themes around this weekend is going to be self-care. So it's not going to be, back-to-back meetings, because, one of the things that we see from a lot of events is that, when you go for, a weekend or whatever, you're having 18 and 20-hour days. and then you leave needing a vacation at the end of it. And we're very much focused on not only self-care for this weekend, but tools that you can take into your day-to-day life. Taking, even if it's just 5 minutes, to take some time and focus on breathing, how to say no without feeling guilty about it. Men, I think it comes much easier for men to say no to people and not to give it a second thought. They just go on about our day. Women tend to harp on that. So, they feel guilty for saying no. They feel guilty for not being everything to everyone. And that in itself really breaks you down. So, and coming from the experience that Stormy and I have had, we really do try to practice what we preach. We try to really set some healthy boundaries, even things like, having set business hours, because we may talk all day, every day, even in the evenings, but we really try to not be working at 7:00 at night because that's our family time. So we try to really set those boundaries, and when you work from home, sometimes that's a little difficult. So I've taken some of the experiences that I've had, over, my 15, 20-year career into this position and say, if we don't set these boundaries, we will be burned out in 2 years and we are not going to have any passion for doing. So we really need to start practicing these boundaries and these techniques early. And so, we get together and we FaceTime yoga, 2 or 3 times a week. And then I teach a weekly online class through Zoom, and we have a Facebook group for that. So, it really is something that we're constantly talking about, and we have these conversations even personally amongst ourselves on how to really reduce the stress level, because we have so much stress that deals, everything from being a caregiver to having a chronic disease to dealing with insurance and doctors and, the fights that we're constantly having to go through. So what are other ways that we can reduce our stress level, and how do we deal with those? And when do you need to seek professional help? Because a lot of times I don't think people, myself included, really realize at what point should I get medical intervention. And so a lot of times it gets really, really bad before, even I will snap to it. I'm like, okay, this is not normal. I'm not feeling normal. Maybe I should go, see a doctor about this. So those are the conversations that we have. And, we try to take a really holistic approach on chronic pain and depression as much as possible. But sometimes you need medical intervention, and there's nothing wrong with that either.
I think especially for people with chronic medical conditions, especially those that are also caregivers, but also have chronic medical conditions themselves, that's a lot of weight to carry. Being able to take that moment to relax and self-reflect and take just a moment for yourself and self-care is so important. I think that's just amazing that you guys are doing that. So thank you for that. I also noticed that your organization currently has a medical advisory council, which is really cool. What has your experience been with that group, and kind of what role do they play in your organization, and do they have any influence at that national level?
So our medical advisory council is made up right now of 3 hematologists and a nurse educator. And the role that they play in our organization is they're kind of our go-to for anything clinical. So whether or not we may have a woman who emails us with a question that, we're not qualified to answer, so we can relay that question on to our hematology team. We use them as kind of the go-to for anything clinical, but we also use them like coming from a doctor or coming from a nurse. How should women approach advocacy in a healthcare setting? Like, what verbiage can they use? And so we use them for that type of advice as well. If we're putting out printed material, we'll send it to them for a review to make sure that everything is correct, because we wouldn't want to put out any incorrect information. So we really use an advisory capacity, and they've been extremely beneficial for us.
Yeah, that's great. That's really awesome that you guys can provide that kind of guidance and support. That's really great. So you mentioned that your medical advisory council helps women with the verbiage that they use when they do see the doctor, and how they can be better advocates on their own with their doctors. Can you dive into that a little bit and what that guidance has been from the council?
Absolutely. So I think the first piece of advice is, any physician will tell you to document. So, we advise women to, not only maybe journal your bleeds and your symptoms, but take pictures if it's something that you can take a picture of. Measure your joints, know what your pain level is on that day, and just make all of those notes and then take those into the physician. Also, it's very hard sometimes to kind of remove the emotion out of our conversations when we've been fighting this fight for so many years. But your emotions, and I'm not saying this about every physician, but some physicians, when you get emotional, they kind of turn their switch off and they're no longer listening to you. So sometimes we're our worst enemy when it comes to advocacy. So one of the things that I'm like, let's practice some meditation and some breathing techniques and try to calm down and take the emotion out of it. We want to approach this from as much of a practical and factual conversation as we can, and tell the experiences and show the documentation that we provided, and even bring in, research that's out there to kind of back up our argument. So that's really, really what we preach is you want to show that you've suffered, and you want to show that, but not so much on an emotional level, but more on a physical and factual level.
I think that's great advice. For anybody, I've had those emergency room situations where you go in and the doctor doesn't know anything about hemophilia, so I can't imagine going in and then having them tell you you don't have hemophilia. But I know that emotional reaction you have and how powerful that can be. So that's really great advice for our community in general. So thank you for that too. Just to wrap this up a little bit, the Women's Bleeding Disorder Coalition is just part of kind of a bigger dream for you in helping women in general. So can you tell me a little bit more about that? Because I would just love for the audience to hear about what you're doing in general.
Yeah, so we're about to have our 5-year anniversary of the Women's Bleeding Disorder Coalition. And last year, we were kind of at a turning point where, we were seeing a lot more programming for women. And we know that one of the challenges that we've had is the politics within the community, the industry, and even the nonprofit side. So, as we're brainstorming about how's the best way to navigate going forward, my husband, who's retired from the Navy, had a great idea to expand our mission, not only to include women with bleeding disorder, but female veterans as well, because they're another population that are underserved. So we went through a formal name change. So we're now the Valkyrie Foundation, and the Women's Bleeding Disorder Coalition is a division of that. So bleeding disorders is still very much in the forefront of what we do, but we also serve female veterans as well. And that's been a really exciting lateral move for us, and my husband's very good at strategy. So, that's one of the things and the more that I get into the veteran side and attend events and meet these amazing women, the more I see that this was the right move for us. And it's something that, Stormy, who's also married to a veteran, something we're very passionate about. So, with all of us being military families, it was a very easy transition for us.
Well, thank you so much, Tammy, for being willing to come on the Ask the Expert podcast and for all that you do for the community. I think it's really important, and I'm really glad that there is a voice for women with bleeding disorders. So thank you so much.
Thank you. Thank you for having me.
And we will be putting links to the Women's Bleeding Disorder Coalition in the program notes. It is wbdcworld.org. Once again, thank you, Tammy, for joining us on the podcast.
Thank you.
Have you checked out Living with Hemophilia yet? If you have, kudos to you. Not only are you eager to join this exciting community of discourse and helpful information, you're also a keen listener and patron of the arts. But if you haven't taken a swim through livingwithhemophilia.com, take a moment to pull it up on the ol' internet. I think you're going to love it. Helpful content, relevant updates, and most of all, a bunch of people going through the same things you are. It's a growing part of the online Living with Hemophilia community brought together by the good people at Bayer. Also, put it on your Facebook to-do list. Hit the like button on Living with Hemophilia's Facebook page. It's a good alternative to looking at the slideshow of your neighbor's recent foot surgery. I mean, unless you're into that sort of thing. Living with Hemophilia from Bayer. Check it out.
And that is all for the Ask the Expert podcast. We'll be back next month with another expert interview. BloodstreamMedia.com is your one-stop shop for all of Bloodstream Media's podcasts for the bleeding disorders community. Once on BloodstreamMedia.com, don't forget to follow the links to subscribe to the Bloodstream podcast, Ask the Expert podcast, Powering Through podcast, and the Bloodline podcast on iTunes, Stitcher, Spotify, or wherever you listen to podcasts. Have an idea for a future episode of Ask the Expert? Have a question you would like to hear an expert answer to? Email us at mailbag@bloodstreammedia.com. You also find Bloodstream Media on Facebook at facebook.com/Bloodstream Media and on Twitter @BloodstreamInfo. This episode of Ask the Expert was written by Chris Bombardier, produced by Patrick James Lynch, Rob Bradford, Joshua Sterling Bragg, Alva Friedman, and Colby Crow. Artwork by Ryan Geelan and Katie Wright Mead, and the Ask the Expert pod is edited by Allison Stoney. I'm your host, Chris Bombardier, and until next time, keep on climbing.